As the Omicron variant drives up the number of COVID cases in the U.S., the Ad Council and the COVID Collaborative have partnered up for the campaign. It's up to you to encourage the public to get accurate and timely answers to questions about vaccines, vaccinations, and anything else they may want to know about the pandemic. Dr. Gerald Harmon, president of the American Medical Association, joins us to talk about this. Good morning, Dr. Harmon. Thank you for being with us today.
Good morning, Amanda. Thank you for having us. Honored to be with you.
Dr. Harmon, we are 2 years into this pandemic. We will be exactly 2 years on March 13th. The country seeing yet another case surge. President Biden essentially declaring a war on the virus yesterday. So the question many Americans may have this morning is, can we still win this war?
Oh, I'm a perpetual optimist. To quote the late Colin Powell, perpetual optimism is a force multiplier. We're going to win. We will win it. We're challenged right now by the latest siege. We'll overcome it. I know we're 2 years into it, but if you think about it, we're only 20 some odd months into it. And that's a very short time when you're talking about fighting viruses. I know it's like dog years. Corona years are going to be one of those parts of our vocabulary. We're going to learn more about it. We're going to have more effective weapons. One of the most effective things we can use right now is vaccination.
Dr. Harmon, as the head of the country's leading physicians group, what is it that you're telling your patients about COVID and what they need to do?
I'm telling them we're not at all out of the COVID pandemic. We're seeing record-breaking spikes every day across the nation, across our state, and locally in our healthcare system. We're also involving more children with this disease as this communicable, very contagious Omicron variant takes hold. So with these daily spikes, I'm warning them to continue to practice social hygiene, social distancing, appropriate mask wearing, appropriate precautions. And one of the most appropriate and effective weapons is to make sure we've received all the vaccinations that we're eligible for.
You talk about the drive that we've been seeing, the record spike in the pediatric cases, the cases in young children. So what do you tell parents who are worried about vaccine safety when it comes to their young kids?
You know, parents are always going to be naturally protective. They're worried about anything. Heck, it's normal for parents even taste food and make sure that it's not too hot or too cold or too potent before they allow especially their younger children, to do something. So it's a normal paternal and maternal instinct. I tell them it's reasonable to have precautions. It's fascinating that many of our parents and grandparents stand in line real quickly to get their own vaccinations, but are a little hesitant and questioning to make sure they get good advice before they allow their children to get vaccinated if they're eligible. It's reasonable. We ask them to check with a trusted advisor, such as their pediatrician, their family doctor, or go to something like the Ad Council's collaborative website, getvaccineanswers.org, and look and make an intelligent decision, a thoughtful decision.
Well, that's what I was going to ask you. There's so much misinformation. We know that, and people are making sometimes making up opinions with facts that just aren't there, that aren't true. So how do they differentiate that?
Well, you have to kind of filter out the noise, Amanda. You're exactly right. And we're fighting a war, we in healthcare, those of us on the front line, and I'll be practicing in an inpatient environment within a couple of hours here in the East Coast hospital that I practice in. We're fighting a war on two fronts. We're fighting a war against the virus itself and the transmission of the coronavirus with all its variants, including the Omicron now. We're also fighting a war against misinformation and disinformation and a little bit of factual distortion and data noise. So we do appreciate opportunities such as this with your TV station to get what we call the science out, the facts out, from an unbiased source such as the Ad Council's collaborative and me as a practicing physician on the front lines.
Yeah, well, we'd like to hear that from people who know the information, who can dissect the data. Dr. Gerald Harmon, president of the American Medical Association. Doctor, we appreciate your time. I know you're a very busy man, but everything you tell us is going to help get us out of this phase.
It's one of the most effective weapons we can use, and it will, as you indicate. It can get us out of the contagiousness that we're in right now. Eventually, we can mitigate the spread, and we can get this coronavirus situation in our rearview mirror as opposed to in the passing lane beside us here.
Yeah, definitely. Dr. Harmon, thank you again, sir.
Thank you again. Honored to be with you. Y'all take care.